Hello, everybody. Welcome to the RealTime Labs webinar series. Actually, this is really the first one, so we really want to welcome everybody here. I just want to say that I've only been back for about 4 months, and I really am excited to be here at RealTime Labs. And I'm really excited to have Dr. Smith here with us because as part of RealTime's mission is to that help the undiagnosed, and Dr. Smith has been doing that for decades. And part of that mission is education, and not just education of patients, but also education of practitioners, because a lot of practitioners are just really new to the issue of toxic mold. I mean, I started doing this about a decade ago, and I can't tell you how many I've talked to literally thousands of practitioners, and every single one of them oh, well, they didn't teach us this in medical school. So we really want to try to normalize the teaching of mold and mycotoxin exposure so that we can start having a good conversation about how to properly diagnose this and how to properly treat it. Because, I mean, more so than a lot of other diseases, mycotoxin exposure, in my experience and me talking to hundreds of practitioners, is that it is different for each person, from person to person, of how to treat them. So, diving into today's talk, we got Dr. Smith out of Grosse Pointe, Michigan. As a University of Michigan alum, I really like talking to people in the southeast part of Michigan because it is a beautiful area, and I really appreciate that area. And I really love to have Dr. Smith on board because she's been really somebody that's been with us for over a decade, and she's been really one of the pioneers. And she's got she spends all of her time in the Grosse Pointe location, but they have two other locations of part of her group there in the southeast part of Michigan. So again, I really want to welcome everybody today, and I really want to thank Dr. Smith for joining us. So Dr. Smith, thank you and welcome to today's webinar.
Well, thank you so much, truly. I don't say any of what I'm looking at today lightly. This is my 45th year of practice. I was very lucky to start out as an ER doc in a level 1 trauma center in Detroit. And then all of a sudden I could not sleep. And I was lucky to go to the very first anti-aging conference at A4M. And there I learned that the reason I had insomnia had a lot to do with the fact that I had no progesterone at all. But there are many reasons for insomnia. And I love this kind of medicine because it looks at the cause of the problem and not just treats symptoms. And so if you're a practitioner joining us today, it's a whole new world if you're just getting into this. If you're a patient joining us today, it really is a very customized and individualized approach. And so I stayed in the ER for about 5 years to actually finance the starting of our practice, of which we have 4 offices in Michigan, 1 in northern Michigan as well, and 1 in Tampa. And we really do look at the cause of the problem. Toxic mold syndrome is much more common than you think, not just in Michigan and Florida, which are surrounded by water, but in many other places as well. I'm blessed to have practiced long enough that I actually have worked with William Ray. He was one of my mentors and probably really is the person who literally brought all of this to the forefront. Dr. Nathan and others now are taking this one step further. But as you can see, there's a lot of references here. And it's surprising, and the reason I put some of these on has to do with the fact that a lot of primary care doctors and other practitioners do not believe in toxic mold syndrome. They actually think that a lot of this is psychological. I assure you, it is not. When you look at toxic mold syndrome, it's when adverse human health effects occur with molds in the indoor environment. And toxic molds mimic or have similar signs and symptoms to classic neurological disorders like pain syndromes and movement disorders and delirium and dementia and disorders of balance. And so commonly neurologists see some of these patients, or immunologists do, or primary care. Also, mid-level providers and even nutritionists sometimes are the ones that really pick up on toxic mold. Mold allergies and mold toxicity, however, they're not the same illness. Mold allergies are due to mold spores that are inhaled. They cause fever-like symptoms. It's different than toxic mold syndrome, which is due to a volatile toxic vapors produced by mold that can cause chronic inflammatory response, otherwise known as SIRS, which is an autoimmune reaction caused by poor clearance of biotoxins. Inflammation is really where it's at. In fact, after the age of 42, every disease we get pretty much is inflammatory in nature, from heart disease to cognitive decline to Crohn's disease and everything else. Also, autoimmune diseases are increasing. When I was in medical school, there was only 24 autoimmune diseases. Now there's 107. The 106th was chronic Lyme. The 107th was long haul COVID. And the 105th is toxic mold syndrome. So, what are the signs and symptoms of toxic mold exposure? Short-term memory changes and confusion I commonly see in my patients. Decreased concentration. They can't remember and pull up words sometimes, so word retrieval issues. Some patients have decreased hand-eye coordination. They may have decreased executive function and judgment, so they just don't make good decisions. Decreased balance, decreased reaction time, decreased blink reflex latency. So their ability to blink is kind of delayed. Decreased color discrimination, decreased grip. But of everything on here, the most common one on this page that you would actually see would be kind of confusion, what I lovingly call brain fog. Upper respiratory symptoms and bronchitis are quite common. Chronic fatigue or chronic fatigue syndrome, again, quite common. Patients can have sarcoidosis, which is an autoimmune disease. Peripheral neuropathy, that sort of numbness and tingling that you get in the extremities. Rashes, we see. Headaches are also a common phenomenon. Shortness of breath, itchy eyes, red eyes, sinus problems, and a lot of allergists even don't believe in toxic mold exposure. So I'm so happy to be invited to give this seminar today because patients will go to an allergist and they will end up saying, oh, just take, Zyrtec or something of that nature, and they will miss the whole diagnosis. I don't say that lightly. I've written 12 books, and one of them I'm a co-author on, and that's actually What You Must Know About Allergy Relief. So having taken a great look at allergies, it's not the same as toxic mold exposure. There's still more symptoms. Anxiety is also quite common. Restless leg syndrome, nosebleeds, dizziness, even vomiting, nonspecific abdominal pain. The poor patient ends up at the gastroenterologist. They have entire workups for what is going on. Fortunately, they don't find cancer or anything else, but they come away with no answer because they haven't thought about toxic mold exposure. Urinary symptoms, weakness, decreased visual fields. The patient can have all of these. Appetite swings from being very hungry to not being hungry at all. Night sweats, tingling, vertigo, meaning dizziness, skin sensitivity, excessive thirst, temperature dysregulation. My patients will wake up with night sweats, for example. increased urination, and disorientation. Yes, there's still another slide. The patient may have an increase in tearing, diarrhea, joint pain, and morning stiffness. So sometimes this is misdiagnosed as rheumatoid arthritis, mood swings, numbness, a metallic taste in the mouth, tremors, and light sensitivity. So what happens is you end up with excitotoxicity. This is a medical term used to describe an over-electrified brain where nerve cells suffer damage or death when the levels of otherwise necessary and safe neurotransmitters, such as glutamate, become pathologically high. This results in excessive stimulation of the receptors. So literally, the brain becomes overexcited. Another disease process where the brain becomes overexcited is epilepsy. People have seizures. Mild toxic brains produce excessive levels of two powerful electrifying brain chemicals, glutamate and PEA. So let's take a look at glutamate. Glutamate is an excitatory neurotransmitter. Transmitters come as excitatory or non-excitatory. There's also neurotransmitters that go back and forth between excitatory and calming, but this one happens to always be an excitatory one. It acts at iatrogenic and metatropic receptors, and when there's a level that's too high, it is literally toxic to nerve cells. Glutamate is a non-essential amino acid, meaning the body doesn't have to have it to exist. It can be converted into glutamine and GABA. GABA is a very important neurotransmitter. And glutamate is made from aspartic acid, ornithine, arginine, proline, and alpha-ketoglutarate, many of those being amino acids. So what are the functions of glutamate? Why is it so important that it be balanced? It balances blood sugar. When it's normal, it decreases food craving. It also enhances pain control, enhances sensory perception. It very importantly fuels the immune system. So when people have toxic mold syndrome, their immune system is compromised. It improves mental alertness, increases energy, maintains digestive health. 70% of the immune system is in the gut, and it maintains muscle health. Other functions of glutamate: it neutralizes toxins. It plays a major role in sensory perception, promotes healing. It promotes a healthy balance between acid and alkaline in the body. It promotes weight loss. So yes, you can have weight gain with toxic mold syndrome. Supports memory and supports motor skills. So you can have, I always like people to eat their way into something. Instead of always taking something, can you take glutamate? You can. But these foods, not all are healthy, but these are all the foods. They're food sources of glutamate. Bacon is one. Don't suggest you live on bacon. Organic chicken would be great. Cottage cheese is a source. Dairy is not for everyone. Duck, of course, organic eggs, fish that is caught way out in the ocean, granola. Ham is an okay choice, but not the best one on this slide. Sausage and turkey. I actually love turkey sausage. You can combine those two together. Wheat germ and yogurt. And yogurt is one of those things you're either a fan of or not. But when we're talking yogurt here, we're talking plain yogurt. You add the fruit, and sugar is not added, or aspartame is not added to the yogurt. Signs and symptoms associated with high glutamate, because you can get too much, are an increase in chronic pain, mood lability, mania, meaning very excited, panic attacks even, migraine headaches, seizures, Parkinson's, ALS, Alzheimer's, all these neurological disorders, bipolar disorder, meaning manic depression, schizophrenia, post-traumatic stress disorder, refractory depression, and autism. So therapies to reduce high glutamate. How do you get rid of it? Well, decreasing foods that are high in glutamate would be great. So if you're living on bacon, it's not a great place to go. Cut out bacon. Reduce glutamate by stimulating glutamic acid decarboxylase, which is an enzyme which breaks it down, and then GABA increases. Reduce glutamic acid decarboxylase inhibitors. So reduce some of these things. TNF alpha is an inflammatory marker, and methionine is a B vitamin. You're supposed to have balance of your vitamins as well. And of course, stimulate glutamate transport and increase glutamate reuptake, meaning transport of glutamate across the body, and reuptake, meaning that glutamate gets taken back up into the cells. So therapies again for high glutamate. When you look at reducing the GLT1 inhibitors, well, what are those? Mercury, homocysteine, arachidonic acid, cortisol being high. So it is important to test for mercury and do a toxic metal test. If the patient's high in mercury, it does need to be chelated out. The most common chelating agent is DMSA. We don't want people to have high mercury. Not only is it a negative aspect for glutamate being high, but it causes cognitive decline and increases the risk of heart disease. Homocysteine, it's an amino acid. About half of you are like me. You actually inherit a gene where you have high homocysteine. We are what is called poor methylators. Homocysteine, this amino acid, if it increases and stays high, it increases your risk of heart disease, stroke, breast cancer or prostate cancer, cognitive decline, and bone loss. So you don't want that to be high either. You can lower it by taking methylated B vitamins. You don't want arachidonic acid to be high. It's inflammatory. Cortisol, your stress hormone, that is best measured by a salivary test. What do you do if cortisol is high? Stress reduction techniques, prayer, meditation, Tai Chi, yoga, Qigong, exercise, massage, breathing techniques, acupressure, adaptogenic herbs like ashwagandha, ginseng, rhodiola, calming herbs like chamomile and lemon balm. You want cortisol to be normal, not too high or too low, again, best measured by saliva. You also want to support glutathione synthesis to improve GABA synthesis, which substances such like NAC or NAC. So you can take glutathione. In the old days, we used to give IV glutathione because that was the only way you could get it into the body. And we still actually use IV glutathione to treat mold toxicity and long haul COVID. But you can now take glutathione orally as a pill or a capsule because there's a liposomal form. So now you can get it in without an IV. Also, NAC and acetylcysteine makes glutathione. And NAC activates the cysteine glutamate exchange transport, which promotes the metatrophic receptors, and it inhibits or stops glutamate from forming. Now, if you take NAC long term as a supplement, it does deplete the body of copper and zinc, so you need to take a multivitamin to replenish that. NAC again is N-acetylcysteine. If you have had cysteine kidney stones, then if you take NAC long term, you can get a kidney stone. How do you stop that from happening? Taking 1,000 milligrams a day of vitamin C, usually, not always, but commonly stops you from getting cysteine kidney stones. These are antagonists of glutamate, melatonin, that very important hormone. Melatonin is best measured by saliva testing, 8 in the morning, 5 p.m., and 3 a.m. with the lights off. I measure melatonin in everybody. It's not a hormone of just sleep, very important for your immune system. Lithium as a nutrient, magnesium. Magnesium has 400 reactions in the body. We talked about NAC, vitamin D. Vitamin D is actually a prohormone. Important to measure vitamin D. The perfect level for most people is 55 to 80. There are some people that cannot do 55 to 80 because they may have an increase in calcium. Your healthcare provider who will know who you are if that's the case. But from Grant's work, Garland's work, and Vasquez's work, vitamin D needs to be at least 55 to prevent breast cancer and prostate cancer. But look here, it's an antagonist of glutamate. Vitamin D does so many things. Also, most anticonvulsant medications are antagonists of glutamate. The interesting thing is, most medicines that are used for seizures deplete the body of vitamin D. So you have to go back and remeasure that. When you have this overly excited brain, the following diseases are related to it: anxiety, insomnia, panic disorder, bipolar, and fibromyalgia. And again, I could have added seizures on here. Fibromyalgia is an autoimmune disease. And what happens with fibromyalgia is the mitochondria, the engines of the body, actually are depleted of their fueling sources. So, what are we actually going to do? Treatment: have the patient avoid foods and drinks that really can cause a problem. So, take the patient off of gluten. If you are a patient joining us today, stop gluten. It will be beneficial. Alcohol. Alcohol is very interesting. It really, honestly, is just liquid sugar. Women metabolize alcohol slower than men. And so, if you're a woman out there, then more than one drink a day increases your risk of breast cancer eightfold. If you're like me and you're a poor methylator, then you do have an increase in developing breast cancer. As I mentioned, I do have breast cancer on both sides of my family. So the American Cancer Society recommends that people like me don't drink alcohol at all. I don't. I'm a teetotaler. So alcohol, again, consider how much you're drinking. Rye, peanuts, corn, barley, sugar's inflammatory, and hard cheeses. All of these actually increase what happens with the mold content. So when it comes to different treatments, what are we going to do? You can see that you end up with different results on your test. If the patient has high gliotoxin, then liposomal glutathione is the treatment of choice. If the other molds are elevated that you see listed here, you need to bind the mold. You can add vitamin C for resistance, and liposomal glutathione will treat these others as well. There's really two ways to bind it, either using the prescription cholestyramine, which is what I did when I had toxic mold years ago. We measure toxic mold. RealTime Lab does do the best job at measuring. It is a urine test, so it's very simple to do. So about 10 years ago, I measured mine. I had high mold, and so actually all of them. So I took the cholestyramine, the prescription. It's terrible. It works, but it's terrible. It tastes absolutely gross. It's gritty, and you cannot have pretty much anything. Vitamins, a lot of different foods, 4 hours before, 4 hours after, because it binds your vitamins too. Very difficult to take. It does decrease the absorption of the fat-soluble vitamins, which are vitamins A, D, E, and K. Much simpler approach is to do clay, I put here, or charcoal. Actually, I'd like to do a combination of both. If you do clay and charcoal, there's a couple of companies that make that combo. It works great. And it's twice a day instead of 3 to 4 times a day. And it's no vitamins 2 hours before, 2 hours after, a much easier approach. And we do treat patients for 3 to 6 months. Now, of course, while we're doing this, we do have your home or the patient's home evaluated for the mold. You have to find the source of it. Is it at home? Is it at work? Maybe it was in a hotel you stayed in, but you do need a professional, someone who is certified to come in and evaluate your workplace, evaluate your home, and get rid of the mold. Otherwise, you'll treat this and you'll just keep getting mold over and over again. So other anti-aging precision medicine approaches for toxic mold syndrome, beside N-acetylcysteine and liposomal glutathione, are alpha-lipoic acid, otherwise known as ALA. Alpha-lipoic acid is one of my favorite nutrients. You cannot eat your way into it. You have to take it as a supplement. At 100 milligrams a day, it really is great for memory, and studies also show it's great for your liver. At 300 to 400 milligrams a day, great for mold and also great to lower blood sugar. The amino acid taurine can also be beneficial. A lot of people are depleting taurine. The number one reason for taurine depletion is stress. And honestly, who isn't stressed? Milk thistle can be beneficial, 200 milligrams twice a day, and then, of course, optimizing GI health. Sometimes you can have a problem with your gut and you're not even aware of it. You can have symptoms that occur outside the gut. It's not just constipation, diarrhea, reflux, and GERD. Fatigue, for example, is a symptom that can be a problem with poor gut health. So everybody in the world, honestly, should be taking at least a probiotic. When we look at glutathione deficiency, it elevates glutamate receptor function and increases neuronal excitotoxicity. So, in contrast, glutathione enhances GABA activated response of the neurons. So, if you're deficient, you have excitotoxicity. Once you replenish it, that excitotoxicity, which we've been talking about, actually calms down. Glutathione is a tripeptide, meaning it's a compound of three things: cysteine, glutamic acid, and glycine, and it is responsible for the health of most of the cells in the body, since it's the strongest antioxidant produced by the body. Starting at the age of 40, glutathione does become diminished. So a lot of people have low glutathione just because of the aging process, and it's part of how toxic mold syndrome can take hold. So glutathione decreases sugar cravings, displaces glutamate from its binding site. That's what we've been talking about here. It enhances liver and brain detoxification of toxic chemicals and heavy metals. It helps to recycle other antioxidants like vitamin C and E. It's involved in protein and prostaglandin synthesis. It's a neuromodulator, neurotransmitter, very important antioxidant. So it gets rid of free radicals. It's part of the amino acid transport system that stimulates the production of interleukin 1 and 2, which helps regulate the immune system. It's used to repair DNA and also for the synthesis or making of DNA, and it helps facilitate cellular magnesium and glucose uptake. Again, magnesium is a cofactor for 400 reactions in the body. So in order for all this to work, the body does need glutathione. These nutrients increase glutathione: alpha-lipoic acid, glutamine, methionine, milk thistle, SAMe, vitamin C, vitamin E, selenium. Now, selenium you can get toxic in. As you heard, I practice in the state of Michigan. Michigan is a low selenium state. So a lot of my patients can take 200 micrograms of selenium. If you're joining us today from North and South Dakota, you have plenty of selenium in your ground. In fact, you have so much selenium that the hay that is grown in North and South Dakota, the first cutting stays in the state, the rest goes out of state. Otherwise, the cows get mad cow disease from too much selenium. You can measure levels, you don't have to guess. Choline. Your cell membranes are held together with choline. Choline is a very important nutrient. However, when you consider supplementing with choline, you want to make sure you've had measured something called TMAO level. Your TMAO is important. You can have high TMAO, which increases your risk of heart disease. Reasons for high TMAO are gut not being healthy or inheritance. TMAO is a fasting study that can be done at any lab. Other ways to increase glutathione: vitamin B12, pycnogenol, N-acetylcysteine, and whey protein. So how does a patient actually get deficient in glutathione? One of the most common ways, believe it or not, is acetaminophen, otherwise known as Tylenol. Cigarette smoking: 1 billion people in the world still smoke. Excessive intake of alcohol, overly processed chemically laden foods. Again, please eat organic. Cadmium, arsenic, lead, mercury, iron, copper, and cobalt toxicity, the aging process, and a poor diet. So symptoms of deficiency: headaches, dizziness, focus and memory are not as sharp, joint pain, sleep disorders, depression, fatigue, and a compromised immune system. So I think you're getting the hint here. There's many reasons why someone with toxic mold syndrome would have a compromised immune system. So ways to increase glutathione production: N-acetylcysteine. You can take the liposomal glutathione, IV glutathione. For the practitioners that are here today, if you're not using IV glutathione, I put how to do it right here for you. You can have compounded, a nasal spray of glutathione, and that works very well. There's the dosages. It can be put on the skin. That would be compounded as well. You can even nebulize glutathione. So in other words, there isn't anyone that we cannot increase glutathione in. And I love the last one, yoga. Yoga has been shown to increase glutathione levels in the body. So if you want to treat toxic mold syndrome, you have to normalize glutathione. When we look at taurine, taurine is a GABA agonist. Taurine protects against glutamate overstimulation. It's the end product of cysteine breakdown. It aids neurons that are overstimulated by glutamate. I'm sure you figured that out from this talk. It has a high lignin affinity for GABA receptors. It blocks GABA degradation or breakdown by inhibiting the enzyme GABA transaminase. It inhibits metastrophic glutamate-mediated calcium depolarization. That one's a hard one to understand, so I'll leave that one to the practitioners on with us today. And taurine activates the GABA receptors in the hippocampus. So taurine has a lot of functions in the body. So it's a very important amino acid. Again, the main reason for someone being depleted is stress. What does taurine do? It aids in glucose metabolism by increasing the activity of the insulin receptor. It aids in wound healing, boosts antioxidant defense, detoxifies toxic substances, helps modulate calcium movement. It improves fat metabolism in the liver. It improves lung health, makes insulin work better in the body. It's a natural diuretic, and it's an inhibitory neurotransmitter. It also lowers blood pressure. It lowers LDL, bad cholesterol. It decreases triglycerides. That's the fat content. High triglycerides do increase your risk of heart disease. It's not just high cholesterol. It's needed for kidney function. It's needed for the formation of bile acids, which are made in the gallbladder. It prevents blood clots. It protects cell membranes from damage. It stabilizes heart health, stabilizes membranes, supports the immune system, and it strengthens the heart muscle. These are all the causes of taurine deficiency. People who are vegetarians and vegans are almost always deplete. We commonly have to give them taurine to take as a supplement. We mentioned stress and then all these diseases. People with liver and kidney disease, congestive heart failure, diabetes, cancer, the aging process, obesity, if you've had radiation for any reasons, and some medications. Every prescription that is written causes between 2 and 10 nutritional depletions. So symptoms of taurine deficiency are anxiety, hyperactivity, impaired brain function, seizures, elevated blood pressure, and high blood sugar. And of course, food sources. You can eat your way into it. So I put some of the food sources here. That should say dairy products. Sorry for the typo there. Dairy products are not for everyone, however. So talk to your practitioner whether dairy is for you or not. Milk thistle is an extract from the seeds of milk thistle plant. We've been using it for 2,000 years. A lot of benefit for the kidney and livers. Silymarin, an antioxidant biflavonoid extract, is found in milk thistle, and it helps promote liver health. It increases the production of glutathione, a great antioxidant, lowers LDL, maintains bile flow, protects against iron damage in the liver, protects the liver from damage due to toxins, and reduces inflammation. Remember, inflammation, a little bit heals. Most people have too much, which causes disease. Milk thistle also decreases blood sugar. It decreases the oxidation of LDL cholesterol, diminishes oxidation, helps prevent damage due to excessive alcohol ingestion, helps protect kidneys from the effects of cisplatin, chemotherapeutic agent, increases the growth of new tissues to repair damaged areas, and increases HDL cholesterol, which is the good cholesterol. N-acetylcysteine, I think we talked a little bit about here. It is a precursor to GABA, and it enhances GABA function. Long-term use we talked about, and the cysteine kidney stones. NAC is an N-acetyl derivative of L-cysteine. It does increase intracellular glutathione, plays a major role in the hepatic, which is liver, glutathione synthesis, and NAC stimulates cytosolic enzymes involved in glutathione regeneration. It also helps with OCD via glutamate antagonism. People with OCD commonly have high glutamate, and results in the proposed augmentation of serotonin reuptake inhibitors. Long-term use we put there already. Alpha lipoic acid, we talked a little bit about. It does get depleted with aging. It also acts as a metal chelator. I did not mention, but it does chelate iron, copper, and cadmium. It does stimulate the sprouting of new nerve fibers on new cells, also strengthens memory, helps with prevent brain aging. So we talked about the dosages already. Here's your food sources, but again, you can see they're limited. It's really hard to eat your way into enough alpha lipoic acid. Everybody after the age of 50 should take at least 100 milligrams a day. Optimizing gut health will also improve what happens with toxic mold syndrome. So you want to remove, replace, repopulate, repair, and rebalance. So in other words, remove bad things, allergens, food sensitivities, replace. Once the offending foods and lifestyle triggers are gone, then you want to work on replacing with digestive enzymes, more fiber in the diet. If you're taking a fiber supplement, please make sure it does not have sugar added. If you're a practitioner joining us today, make sure you recommend a fiber supplement to your patients with no sugar. You want to replenish the vitamins, minerals, and other nutrients. Of course, repopulate with good bacteria, otherwise known as probiotics. Patients may also need prebiotics, which is food for the probiotics. I usually don't start them at the same time. I give probiotics for a month, and then the next month add the prebiotics. You do want to repair the gut lining so that it's no longer inflamed. So vitamins A, D, C, amino acids, glutamine, can also repair. And then rebalance, fix the lifestyle. It really does come into play, even with gut health. It's important to address the external stressors in your life that increase the sympathetic drive so that you are kind of turned on all the time. You want the parasympathetic drive that calms you to also be turned on. So, yoga and meditation, prayer, all these calming techniques are very important. You do want to repeat lab testing if the patient has come back, or if you're a patient, you've had any of these molds as being positive, then after 3 to 6 months, repeat the mold testing to make sure that the mold has been resolved. The good news is it's very accurate. RealTime lab, and I do use this lab in my practice. I have for more than 10 years, is very accurate. And because it's a urine test, it is very easy. So when we look at a case history, this is actually one of my patients, a 51-year-old perimenopausal woman who came in with many symptoms of menopause, and she just wasn't feeling well. So we actually did a saliva test. We fixed her hormones, and half of her symptoms were gone. So she then became menopausal. She needed estrogen. We gave her that, and 3/4 of her symptoms are gone, but she still had symptoms. A gut health test was done. She did have dysbiosis. We did the 5R program, and then more of her symptoms resolved, but she still had anxiety, insomnia. And that's when we did a real-time mycotoxin mold test. And this is actually her results. And you can see here, we now have the new 5th mold that's on there. It's very important to get that one as well, because the ZIA one is the one that if it stays high, there is an increased risk in breast cancer. So we want all of these to be fixed. You can see this particular patient had the first 4 and then was equivocal, meaning borderline for the ZIA. So we want to fix all of these. So the patient was started on liposomal glutathione. We did give her a combination of clay and charcoal. This one happened to be clay and charcoal that was made by a company as one combination. We had an inspector come to her house and workplace to fix the mold that was there. And she did have mold in her home, so it was remediated, meaning they got rid of it. Her insomnia and her anxiety improved. So then we had a much better test. It wasn't perfect yet, but it was a much better test. You can see here that now 2 are present, 3 are present, 2 are not. So we're getting an improvement. So we kept her on the liposomal glutathione and the clay and charcoal again for another 3 months, and we will repeat this study. So we also added taurine, 500 milligrams twice a day, alpha lipoic acid in the morning, and milk thistle. And again, we'll repeat the real-time lab test. So in conclusion, as you've seen, it's very important to consider toxic mold syndrome in the differential diagnosis of patients. If you're a patient joining us and you've got some of these symptoms, then please talk to your doctor about testing for toxic mold. It's paramount that you measure the levels with ELISA testing and then remeasure to make sure that all of the mold has resolved. Thank you very much. Do we have some questions?
I think we do. I guess I can read them to you, Dr. Smith. And
that would be great.
Okay, first question is, do you recommend DL? I think it's probably supposed to be LALA or RLALA for mold.
Actually, in the United States, actually, if everybody I think today is joining us, there's only one form available in the United States of ALA.
That would be the D form, I believe, right?
That is correct.
Yeah, because the R form is actually not found in nature, and I don't think the body even knows how to like process it.
It doesn't. And one company has brought the R-lipoic acid forward and has recently become available in the US. But again, not a lot of studies on how well it's processed.
I would imagine it probably wouldn't be very much. I mean, as much as I know about molecular biology, so and I know a little bit. Um, can you take a blood test to determine your level of glutamate?
You can probably best measured, however, by urine.
Next question: what brand of charcoal clay supplements do you recommend? What dosage and ratio?
I kind of hate to get into different companies that make things, but on a webcast. But if you email me at faafm63@yahoo.com, then I'm happy to give you what I use. So that's faafm63@yahoo.com.
Sounds good. Yeah, I also will give. I also will during. I do consults myself with practitioners. I will give some. I mean, I've done a lot of like follow-up exam testing for with practitioners, so I kind of have a good idea of what works. So I'm also happy to talk to practitioners and give them some like clues of like what I have seen have worked for other practitioners as well. Okay, next question. Does living next to high voltage power lines pose a significant health risk? Does EMF exacerbate mold mycotoxin release?
There's not a lot of studies showing that EMF exacerbates it, but EMF is really not good for anybody. So I have a cover over my little computer here. I have an EMF rod sitting next to me, and living near high voltage lines is never a good idea.
Yeah, no, I would agree with that. Next question. What are your, I guess, like, what's your opinions between using Dr. Shoemaker's protocol or a protocol such as like Jill Krista's or maybe Neil Nathan's? What's your, like, have you like looked at the different protocols and where does your protocol kind of like fall in that spectrum?
Well, Jill Carnahan and I know each other very well. So her and my treatment is probably very similar. So I really think ours is a very tried and true method that anybody who's on today, I think, would be very happy with.
Yeah, I've seen Jill speak a lot. Jill Carnahan speak. I've seen Jill Carnahan and Jill Krista speak many, many times. I appreciate both of them greatly, and yeah, no, I think that both of them have very good protocols. Do you work with PANS, mold, OCD kids, and what is your experience?
I don't. I did residencies in emergency medicine and internal medicine. So honestly, I don't see anybody under 16. So I'm sorry, I cannot comment on that.
I think that's fair enough. I think if someone is low in iron and copper, should they avoid ALA?
No, not really. We usually just start at 100 milligrams instead. If someone is low in iron and copper, the question is why? Usually copper, it's because they don't eat a good diet. When it's iron and it's a woman, obviously her menstrual cycle is the number one reason. For the practitioners out there, when we measure ferritin for thyroid to work, so you have an adequate conversion of T4 to T3, ferritin in a cycling woman has to be 130, and ferritin in a menopausal woman and in a male has to be 100. A lot of doctors honestly don't know this. They think that it's okay to have a ferritin of 70, and it's not. The thyroid does not work optimally when you do that. But 100 milligrams of ALA, to answer your question, probably will not affect that. 300 to 400 may. Certainly at 600, I never give that much unless I'm treating hepatitis, because at 600, it negatively impacts the conversion of T4 to T3 and iron, etc.
I'm afraid the next two questions are for me. So we're talking about the mold mycotoxin test here, and they're asking why is the trichothecenes all lumped together, and what's the difference between ELISA and mass spec? So I'll kind of like answer both of these together. So the trichothecenes are all lumped together because they have very similar structure chemically. And the way that the ELISA test works is it's actually antibodies directly to the mycotoxins themselves. And the way that it works is that the antibodies bind to mycotoxins, and then you can see like a color change on the plate that we read through a spectrometer of like how much is the color change. That tells us how much mycotoxins are in the sample. The great thing about ELISA is that it looks at both modified versus unmodified mycotoxins. And most of the mycotoxins that come out of the body are modified, which is like the big difference between ELISA and mass spec, because mass spec can only look at what you're teaching it to look at. And almost all the other companies teach it to look at unmodified mycotoxins. So like mycotoxins that aren't bound to glutathione, aren't bound to sulfates, aren't bound to OH groups. So all these like different modifications make the mass spec not to be able to see them. So when you like see our results, you're looking at both modified and unmodified mycotoxins coming out of the body. And the fact that most of them are modified means that you could get a false negative pretty easily using a mass spec test. Sometimes it's the only thing that you have, but in our case, we do have the ELISA test for a lot of the most common mycotoxins. So that's the reason why I really have like moved towards saying that that is probably the better test for this particular problem. Okay, so hopefully that answered your question. Next question for Dr. Smith. Does black Spanish radish root also help clean out mold? Do you know anything about that?
It probably does. It just doesn't have enough clinical trials for me to mention it today. Garlic may also have that same positive effect, but again, not just enough clinical trials.
Next, similar question. Are humic and fulvic acid-based binders equally effective for binding mycotoxins?
The propensity of the literature looks at clay and charcoal and cholestyramine and related drugs next. That would be much farther down the line.
Yeah, that would be that's what I've read as well. This is also very hard. This next one's also very hard. How long does it take to clear mold out of the body? I'll let you answer and then I'll give what I have seen.
At least 3 months. Of course, that means when the patient's no longer being exposed to mold. So most of my patients actually ended up being treated for 6 months because we start the treatment right away. Then they have to get a hold of an inspector and then it has to be remediated. And so it turns out for many people to be a 6-month process.
Yeah, I will agree with, I mean, I say that's definitely the average. I have seen it go from anywhere from like 3 months to a year and a half, depending on like whether or not you can like clear up the exposure. But then the exposure is like in twofold. Like exposure comes in two different areas for me. I see you get exposure from the home, but then you also like about 30% of the time you get exposure from, I have seen internally, which we like when you get like a biofilm forming some type of colonization, mostly Aspergillus or Penicillium forming a colonization, and then you get mycotoxins from that. So you have to clear that out before the mycotoxins start going down. So sometimes in those cases, it can last a lot longer. Okay, well, I'll let you talk about this first, then I'll give my answer. Before urine sample and collection of mycotoxin, is glutathione challenge suggested for a couple of days prior?
Actually, that's not the way I was taught to do it, nor the way I have done it. But in fairness to that answer, a lot of my patients, I've already measured. I've looked at methylation, for example, and if you're doing a methylation test, you'll see if the patient is literally low in glutathione. So I probably have a different answer than everybody would give on that one.
Yeah, so my answer is, so Dr. Neil, Nathan, and I it's about 5 years now, did a study of plus and minus glutathione for patients that haven't been tested yet. We found that we got better results doing a 5-day push with 250 milligrams of glutathione, and then on the 5th day doing like a sauna or a hot bath or exercise, and then collecting on the 6th day. The one caveat to that is probably about 10 to 20% of the sample size like had to drop out because they started getting like symptoms from mobilization of the toxins. So for those patients, we collected when they dropped out, and all of them showed up positive on the dropout. So you definitely have to, like, if a patient feels really bad on taking the glutathione, then you probably just want to collect right away for those patients. So
that's honestly why I've never considered doing that, Matt. So it's interesting you would see it in 20%. Thank you for letting me know and everybody else what percentage that would be.
Yeah, I mean, it's definitely not. It's definitely not. It's not an insignificant amount, and but I find that like I definitely get. And the reason why we did that study is I'd say like probably about 10 to 20% of our patients come through. We get like a false negative because they're not excreting any toxins out. And then after we start doing the provocation, we start seeing toxins afterwards. So I really hate to like get the patient confused about why they can't find why we think they have mold, but nothing comes up on the test. So I really want to like decrease that incidence of getting a false negative because of lack of excretion.
Perfect.
Let's see here. How often tests should you think that we should repeat?
Well, I repeat everybody in 3 to 4 months, no matter what. And then if they're still positive, I repeat them again in 3 months.
Yeah, no, I completely agree with Dr. Smith there. I mean, having seen thousands of these tests, and I have a lot of practitioners that test every month, I'll tell you that like I see the most differences after like on a 3-month time frame. I think that that's probably doing it shorter than that is probably not clinically relevant. But one caveat to doing the first like time point is knowing that like in 60% of the patients, the values go up most of the time in patients at the 3-month time point, because a lot of times you're with the treatment like Dr. Smith recommended, they start excreting more toxins, and a lot of times they're feeling better, but you get to like make sure that before you do that test, and you like counsel them saying that like these values might go up, but it's not a bad thing, it's a good thing, because this means that the toxins are coming out more regularly. One question is, yes, we're going to be like, we will in our newsletter, we're going to show a link to this replay. So we are taping this, and we'll be sending out a replay of this to our email list. It will also be on our website in a couple of days. Okay, I think we got through all the questions here. Thank you again, Dr. Smith, for joining us. I thought this really was informative. I really appreciate your time.
My pleasure, truly.
Okay, well, thank you everybody else too. And if you need anything, we are here, and we are happy to help you. Have a good day.
Have a great day, everyone.